Hi, my name is Tara McKean. I'm with Columbus State University. I'm presenting a project for Nursing 4698. My project is on the importance of using two patient identifiers, that is in MPSG 01.01.01. Use at least two ways to identify patients. For example, use the patient's name and the date of birth. This is done to make sure that each patient gets the correct medications and treatments. That is from National Patient Safety Goals, Joint Commission 2018. The failure to correctly identify patients can lead to many issues. It can lead to medication errors, it can lead to transfusion errors, testing errors, wrong procedures, and newborn infants going to the wrong families. There's 5 rights. Using 5 rights will help identify the right patient, the right test, the right time, the right diagnosis, and right indicators. This will help limit the errors that will cost the hospital more money in unnecessary testing procedures and potential harm to patients. A case study that I used, it was with a newborn infant. It was handed to the wrong mother. There was no harm done to this patient, to the newborn patient. However, the plan of care was altered because the mother was wanting to breastfeed the infant and not wanting to introduce any formula to this infant. So the plan of care was altered, and it could have been it could have had a fatal effect on the infant. Research. I did research, one of the research studies that I read was a hospital researched how to improve patient safety. This hospital used a safety team to round on the patients to make sure they had correct identifiers in place. If the identifiers were not in place, then they explored the issue on why these identifiers weren't in place. And they found out that a lot of the identifiers, such as armbands, were taken off of the patients due to starting an IV, and then the armbands could have been too big or too small for the patient, or the complaint of discomfort of the armbands by the patient. How they improved this situation, this hospital improved the situation, was they printed up more than one armband and made it readily available to apply to the patient. And they also recommended buying Velcro ID bands so they can be readjusted. With this, they decreased the amount of patients having no identifiers, and so that was pretty effective on that. And it said that the wearing of the ID bands increased to 100%, and the missed identifications decreased to 36.5%. And this was by improving the patient identification process 2015. Another research a study was performed on preventable potential fatal patient identifiers. This study showed that anyone on a healthcare team can make mistakes that could cause harm to a patient. This would include physicians, not only physicians, nurses, but lab technicians, pharmacists, and even transporters. An analysis of the reported events showed mistake in correctly identifying a patient can occur in multiple procedures and processes. Identification mistakes can occur in every healthcare setting, and many patient identifier areas affect more than one patient. For example, if you have 2 patients with similar names, then one patient may get the other person's medication, but this would probably affect the other patient because they will potentially get patient A's medicine. So a lot of these errors do affect more than one patient. A key takeaway from the ECRI Institute's research is that most, if not all, wrong patient errors are preventable. Another research here is a study was performed and showed that the patient identification errors have become a critical issue for hospitals. 7 to 10% are identified incorrectly by the EHR. The estimated 2.3 million Americans were victims of medical identity theft in 2014 and had to pay wrongfully out-of-pocket expenses. Identifiers such as ID bands, social security numbers, and patient addresses can easily be mistyped and used and cause medical errors. Actually, I had something happen in the hospital not too long ago where we had a patient come in and his name had an L in it, but they put a patient's name that did not have an L on there, and they were very similarly spelled. So we did chart on the wrong patient because that patient was not even in the hospital. We found out before he was given any medications because we did do at least 2 patient identifiers, and we found out that it was the wrong patient. So we had to correct that. And it says these errors can be eradicated at the point where they originated, and that was the registration desk. So registration did have to go back and correct all of the errors and make sure that the patient that was not in the hospital was not charged for these issues. Approved patient identifiers. Some approved patient identifiers are patient's name and date of birth, assigned medical record number, social security number, and phone number. This is by the the National Patient Safety Goals, Joint Commission 2018. Unacceptable patient identifiers are the patient's room numbers in the hospital. The reason this is unacceptable is because many of times we have to change a patient from one room to another in the hospital due to air conditioning not working or loud noises. So we can't just use a patient's room number as an identifier. Medication administration. In the hospital, 2 patient identifiers are required to administer medications, as well as what we do is we ask the patient to identify themselves, give us their name and the date of birth. So we use those 2 patient identifiers. We also scan the ID band. By scanning the ID band, this links us to their EMR. Once we scan the identification band, then we can scan the medication because it has a barcode on it as well. The barcode, if it is not the right medicine, the right dosage, the right patient, then it gives us an alert saying this is wrong medication or wrong patient. So that does help with a lot of the medication errors. Also, with not just the medications, for blood transfusions, this is a similar process that we use in our hospital for blood transfusions and procedures as well. In conclusion, using at least 2 approved patient identifiers, this reduces the risk of medication errors, mislabeling of specimens, blood transfusion errors, and other potentially harmful events, such as the newborn infant being discharged to the wrong family. It also protects the hospitals and staff from legal and financial liabilities, and most of all, this protects the patient. These are my references. My audience today was
Brian,
Ann,
Logan.
and thank you so much for listening to my presentation.